Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. My guest today is a rising star in podiatric medicine, Dr. Kristine Hoffman. She's currently the residency director at the Denver Health Podiatric Medicine and Surgery Residency Program. She's the chief of podiatry and an attending physician in the Department of Orthopedics at Denver Health. She's also an assistant professor in the Department of Orthopedics at the University of Colorado School of Medicine. Welcome to Dean's Chat, Dr. Hoffman.
Thanks so much for having me, Dr. Jensen. Appreciate it.
It is my pleasure. And Dr. Hoffman, we're very informal on Dean's Chat, so if it's okay with you, let's go with Kristine and Jeff.
Perfect. It's always hard when you're talking to your former attendings to call them by a first name, but I'll do it. I got it.
No worries. So full disclosure for all of our audience, back when I was in practice in Colorado and we had started the North Colorado surgical residency program, Kristine was one of our residents, one of our star residents, and I'm super proud of her, you, Kristine, for really taking on some leadership roles in our profession and really leading the way. I want to congratulate you on so much success young in your career.
Oh, thanks so much, Jeff. I appreciate it. I've been very lucky and had some great opportunities, and of course, the training I received definitely was a big part in getting to where I am today.
Well, that's fantastic. So I was thinking maybe the first thing we should talk about is your residency program, because that has really taken off, Kristine. My students at the Arizona College love coming up to Denver. They love rotating at Denver Health. They love working with you and your residents. Could you tell us a little bit about your program and maybe the origin, because it's a newer program also as it evolved, if that's okay?
Yeah, so we're in our third year. There's been a push amongst the VA hospitals to continue to have resident physicians and resident education, but to shift the base or the ownership of programs to other institutions. So 3 years ago, we transferred the Eastern Colorado VA, known as the Denver VA, program to Denver Health, which I think is very much a win-win. Denver Health is the Colorado's main safety net hospital. So we provide level 1 care for all. So we have a lot of indigent, homeless, a lot of patients facing pretty dire social situations. We see a lot of refugees, so we get some really crazy pathology. And then we're also one of the main academic teaching hospitals. So we're one of the main teaching sites for University of Colorado. And then we host our own residency programs. We have several OMFS, emergency medicine, podiatry, and several others. So we have a really robust Department of Education that supports us. And then they get to interact with all of the other residents, both in our programs and from the University of Colorado, and then other residency programs throughout Colorado, which is great. So we transferred it here, and it's going really well. We have some of your students who are phenomenal as current residents, and love having your students out here with us.
And that's fantastic. It's kind of nice. Colorado's kind of got the trifecta going between PSL, North Colorado, and Denver Health right now. It's a great 3-month tour for students.
Yeah, definitely. It's really awesome. And we still maintain a big affiliation with the VA. So our residents go there and our students go there. So when they come, we kind of do it in blocks. So our students will do 2 weeks at the VA and then 2 weeks at Denver Health. And depending on how many we have each month, we'll flip-flop them between the two. So we found that works really well, so they get to see both sides. It's great for our residents. When they rotate, we have community physicians that are in private practice that they work with. They work at a safety net hospital, level 1 trauma center, an academic institution, and the VA. You pretty much can't find anything that's not there.
Yeah, all the bases are covered for sure. I talked to Dr. Jeff Robbins, who oversees the VAs around the country, and he told me about this initiative several years ago. And can you share with our listeners, because this is going on around the country, kind of the opportunity, the trials, the tribulations, and how it's really, I mean, obviously it's worked well for us so far in Denver.
Yeah, I think the transition process was definitely not the easiest. Working with two big institutions was definitely tough. We were one of the first, so it was a lot of figuring things out. I always welcome anyone who is doing the transition. I'd be happy to help. And we've talked with CPME to offer resources just of what we learned to do and to not do. I think the more diverse that you can have residency training programs is really good. You can bring some of that outside perspective to the VA, and you can also bring some of the VA perspective to other institutions. So I think adding that diversity to residency training is a really good initiative. And sort of blending some of these programs where you can split your time between major institutions, I think will be really good for our profession.
Oh, there's no doubt. And interprofessional conferences and meetings and discussing patients, I mean, everybody wins.
Yeah, definitely. It's awesome. It's fun. I was just on the phone earlier with some of our VA faculty. It's great to have that sort of network of, people to talk to and to bounce ideas off of. And I think, both in terms of practice setting as well as education setting, both have their own opportunities, which is great.
No doubt. So let's talk specifically about the residency program. It's a 3-year program. And do you mind breaking down the years and the experiences that the residents get each year? And realizing, Kristine, there's a lot of students that are listening to this, September, they're already talking about it, the second-year students, right? They haven't even taken boards yet. And they want to start talking about, where am I going to go? What's going to be my tour of clerkship? So that is kind of who you're going to be talking to here when you describe the residency. So the floor is yours.
Yeah, so in our first year, our residents, we do month rotations. And so they rotate between for podiatry, the VA and Denver Health. And then they do a lot of their off-service rotations. So our first off-service rotation, or one of our first, is ortho ID. We have a specific ortho ID department that is phenomenal here. And so they work with them, learning a lot of sort of the hospital systems as well as antibiotic management. We have so many co-patients with ortho ID that we actually do a dual clinic. So there's a lot of really good crossover. And then ID, we find there's sort of like, I was talking to one of our ID providers this morning. We call them Switzerland. So they're like the sort of between everyone, the medicine teams and the surgeons. So it's a really good kind of place to start. And the residents utterly love that. And then they also do general surgery in their first year. We have a really big general surgery program. They are treated no differently than any other medicine resident, which I think is awesome. Our residents have been so well received by general surgery that somehow the residents got a hold of the podiatry schedule and assumed that everything that said surgery meant that they had a podiatry resident on general surgery. And they were very sad to find out that was podiatric surgery and not general surgery. But definitely made my heart sing to realize how much they enjoyed having our residents with them. And then they do internal medicine. So they do a month with our hospital medicine service, and same thing. They're 100% in on the teams, no different than any other medical resident. And they have excelled there. And they also do a month of ER. So you get to see a lot of pathology, get to do a lot. Our ER providers love them. So it's been a great opportunity. And they are on like a rotating schedule. So they have podiatry in between. When they're on their podiatry rotations, they alternate between outpatient, clinic, and elective surgeries, and then inpatient. Our inpatient volumes are crazy high. We had really bad winters, so we had a lot of frostbite. So they're doing a lot of the more dirty cases, but our first year's case volume is really high. Because we're such a busy hospital, we'll often even run 2 rooms. So residents get a lot of autonomy doing cases on their own as they sort of build that confidence. And we feel that they're up to it. So it's definitely a really good teaching opportunity. They get a lot of autonomy that you don't see in more private practice settings. And then as the first year progresses, they start building their surgery skills and start doing more of the forefoot type procedures, hammer toes, bunions. We're really big on having the students or the residents teach the students, and then our upper class residents teach the junior residents. So depending on what each resident feels comfortable with, they'll decide, who's going to do what case. So we don't have really a fixed progression. It just depends on where each individual feels like they're at and what they need more of, or what they feel like they're ready to give to their more junior residents.
Well, that makes sense. I'm having a flashback, Kristine. I remember when you were a resident and you were on vascular surgery rotation working with Dr. Cooper.
Dr. Cooper!
He came across the hall one day because our offices were across the hall from each other. And he says, I've been doing surgery with Kristine and she's got phenomenal hands. I wish she was going to become a vascular surgeon.
I remember we had done like an aortic aneurysm and he just scrubbed out and let me close. And I was like, ah.
No, I remember that like it was yesterday, but we're talking like 15 years ago.
He was
right?
so fun.
Oh, that's fabulous. So that's just an outstanding experience that your residents are getting. What's your third year look like? How much autonomy? Are they calling their own shots, or how's that working?
Yeah, so kind of second and third year sort of blend together. So second year, they do a little bit more of the surgery rotation. So they rotate with vascular surgery, physical medicine, rehab. We actually do an addiction medicine rotation, which has been an amazing addition. We have an addiction medicine team. So for behavioral health, they do a focused addiction medicine. We're actually looking at working with our addiction team on the benefits of incorporating that into podiatric education because the residents have just loved it. I feel like it's one of the most, I want to go do the rotation. Right. We actually have had some of the medicine attendings at Denver Health go and rotate with addiction medicine because they feel it's so beneficial. So they do that. And then they are doing more and more cases. And so they again rotate between Denver Health, the VA, but they start to incorporate some of our surgery residencies, which is basically you get to pick what you want to do. So you're basically bouncing around to the more of our community cases, getting to pick. Usually they get second choice after the more senior residents, but they start getting to pick more of those elective cases. And then in third year, they do research rotation and they rotate with ortho trauma. We are part of the Department of Orthopedics, so they rotate with our trauma team, which has been really fantastic. Orthopedics at Denver Health is really supportive of podiatry, which is great. And that's when they're really doing more of their surgery rotations and have that first pick of the elective outpatient cases, cover various providers in the Denver area and some providers in Colorado Springs. And they get definitely a lot of autonomy in terms of where they're going and what they're doing, what cases they want to cover. I was talking to one of our residents and he was describing our program as, they get a lot of autonomy that really, but enough support to where you're not uncomfortable, but like push you to the edge. And he's like, I think that's like the perfect place to learn. It's like, oh, that's such a good description.
Right. Oh, absolutely. Yeah, it's hard. It's hard to make that transition from being under the watchful eye to making decisions on your own. You need help doing that.
Yeah, and it's just even things like when when we're running to rooms and you leave, they get asked like so many times. Our scrub techs will ask like, "What suture do you want?" And the residents are like, well, I get a pick, and they're always waiting for kind of the attending to drive and the attending preferences. So I kind of love when I leave and I can hear in the back behind me that them telling them what they need, and it gives them definitely, I think, a really good stepping stone into practice because they have had that level of independence.
Oh, that makes sense. You had mentioned you have a research rotation. What are some of the things that your residents are working on, Kristine?
We have a lot. Matt Gorski runs our resident research. We have some studies looking at fixation for first MPJ fusions. I've done a fair amount of gait research. I have a twin sister. She's a professor down at Fort Lewis College in Durango. And she and I have done a lot of studies looking at how sensory feedback drives gait changes, specifically looking a lot into barefoot running. So we have some opportunities there, which is great. Gives our residents some opportunities to work with pre-med students. And Durango's Fort Lewis College is a Native American serving institution, so it's great to be able to expose some students that otherwise wouldn't get to into the field of podiatry, which I think is the best in medicine. A little biased, but
we'll delve into that in a little bit.
But so a lot of, and then we have several residents are working on some studies with our orthopedics infectious disease team. Sebastian, one of your former students, who's now a resident, is working with them on a strep antibiotic coverage. We actually did a great study. Ankur Gill, one of our former residents, who's now one of our attendings in private practice, did a fantastic study that's actually been used in the Infectious Disease Society guidelines on the use of oral antibiotics for osteomyelitis. Our patient population are often not great IV antibiotic candidates. And so the residents' work with OrthoID has definitely shown that orals are a viable option, which has been great. It's great to see your studies referenced in pretty groundbreaking work.
That is incredible, and that's been a topic of conversation for years. The bioavailability and can it treat osteo? And Warren Joseph is faculty at the college, so we sit in my office and debate these kind of things and talk about them all the time. So it's great to see that you're putting it to work in the real world. Thank you.
That's awesome.
For sure. So let's shift gears a little bit. You did your undergrad at UC Boulder. And then you went to the Scholl College. Why did you go to the Scholl College? What attracted you? Well, maybe even before that, what attracted you to podiatric medicine?
When I was in undergrad, I worked in the psychoneuroimmunology lab, and I loved it. We were looking at how exercise protects the brain against some of the effects of stress. So we had our basic rats that had wheels in their cage and they'd run all night, and rats that didn't. And then we'd stress them, which I utterly hated. And then look at how the differences in the brain areas, comparing the ones that exercised and the ones that didn't. And we saw a lot of effects similar to antidepressant medications, just with having a running wheel in their cages. So I loved kind of the science part of it. My favorite part was when we did surgery on the rats, but I also did not like working with rodents. So that kind of prompted me. I spent some time with different medical specialties, cardiology, general medicine, hospital medicine, and then spent some time with a podiatry group in Boulder and really loved podiatry more than any of the others. Really like keeping people active on their feet. So that kind of led me down the path of podiatry. The podiatrist that I spent time with went to Shoal. So that was definitely a driving factor. And then my boyfriend at the time was also from Chicago. So that also helped kind of spur the direction as well.
Well, that was great. And then I remember you were coming out to do a clerkship and spent time in Denver. And I was so pleased when we matched and you were committed to doing your training in Denver. Comment on residency. I mean, how was that experience for you in Denver, and how did it contribute to your future?
Yeah, it was great being back in Colorado. I'm a Colorado native, so I definitely am fully Colorado at heart. My entire time in Chicago, I feel like every rotation I would like try to get totally dressed up and look, and I'm like, they're gonna like, I fit in, and they're like, oh, you're the girl from Colorado. It could never escape my Colorado roots, so it was great to come back. Residency was good. It was tough. We had a little bit of a sort of change at the beginning when we first started our first year, where it was uncertain status of our second and third year. So definitely put a bit of stress on. But like the things that don't kill you make you stronger. So probably a lot of that led me to where I am today. We ended up not taking a class behind us. So kind of got to do the first year work and the second year work, which again, I think definitely, while it was hard, is also good. I am a hard worker. I do a lot. I was looking at my RVUs today, and they're over 200% of my benchmark. So that probably was where that came from. Our program was great. We got to work with great providers like yourself. Worked with Mike Houghton, a foot and ankle orthopod, who is definitely very influential on my career. And then after I finished there, I think was able to maintain connection with the group that I first spent time with in Colorado, and joined their group in Boulder.
That's great. I have this distinct memory. You were so into rock climbing, and I always thought Boulder was the perfect place for you, so you could escape to El Dorado Springs and do some rock climbing, even for a couple hours, right?
Definitely. We live in South Boulder, and so El Dorado Springs is about maybe a max 10-minute drive from our house. I don't climb quite as much as I used to, but my daughter's really into climbing now. So we at least go to the climbing gym once a week. And then now that the weather's getting nicer, we'll start getting outside, which is always, we have so much climbing, right? We can walk to climbing the Flatirons right behind our house.
So let's talk about fun things outside of podiatry. So let's talk about rock climbing a little bit. You and your husband used to do some incredible climbs. Can you comment on some of the climbs and the difficulty? Because I had to live vicariously through you, because I used to rock climb when I was 17 and 18 years old in El Dorado, in Yosemite. And then when you came to Colorado and started doing all those wild routes, I thought, oh my gosh, that is so incredible.
Yeah, I started climbing when I was in middle school. I did a lot of competition climbing when I was younger, won several national competitions, went to Junior Worlds in France, did horrible there, but I gotta go. And then when I was in undergrad in CU, Boulder, obviously climbed a ton. And then kind of shifted when I was in Boulder from more competition climbing to more outdoor climbing. But was definitely a big sport climber through high school. I would lie to my mom and spend summers sleeping in my Subaru, climbing in Rifle Canyon, which is known for its very overhanging, steep sport climbs. So I think hardest, never cracked 513, but definitely did several 12Ds, which was great. But then in college, shifted more to traditional, not really traditional climbing, still kept sport climbing outside. And then when I met my husband, now husband, I think our first date was a trail run, and our second date we went climbing. So that transitioned me more to trad climbing. We spent our honeymoon rock climbing in Patagonia, which most people don't think of as a vacation. We stayed in a tent and a shack made out of rocks and plastic, and climbed in the Bader Valley in Torres del Paine.
So I have a question for you. We haven't talked about this. What do you think about Alex Honnold's free solo of El Capitan in 2017?
It is crazy. Funny, the last movie that I went to in the movie theater was Honnold's free solo movie, and he fell asleep. And that's when my husband was like, I'm never paying for you to go see another movie and sleep. But it's crazy. He's an amazing athlete that utterly terrifies me. I've actually met him in Boulder a couple of times. He's super tall.
Yeah, and for our listeners, Alex Honnold was the star of the free solo movie, and he climbed El Capitan, which is a 3,000-foot monolith, if you will, in Yosemite Valley without a rope. And
yeah, it's just like that. I mean, just talking about it makes my hands sweat.
Me too.
The part when he kind of gets a little panicked when he's on kind of one of the ledges in the steep part, I just can't even fathom. Yeah. It's pretty awesome. When I was competing and climbing, it was kind of the days of Chris Sharma and Tommy Caldwell. And so I used to climb with all those people. And it's, I didn't, pursue the kind of rock climbing career. It's awesome seeing these people that I used to know doing these amazing things. My dad and I just they had the Real Rock Film Festival at CU, and seeing like Josh Wharton, I went to undergrad with. I used to climb with them all the time, climbed with them in the gunks and a lot of trips, and watching his movie, it's pretty awesome to see.
It's incredible. It seems like it was yesterday, but it was a long time ago, I guess, when I think about climbing. So hey, let's talk about some more recent things. You are an avid trout fisherman. Or let me recoin that. You are designated Troutwoman.
Yes. I love fishing and running. So several years ago, I was buying flies at the hardware store, because Boulder, so you can buy your flies at the hardware store. And a guy there was, we were talking, and he was asking where I was going, and I told him I was running up to this lake outside Leadville. And I told him I was going for a run in Leadville. He asked if I was doing the Leadville 100, which I was not, which you've done, haven't you?
4 times.
That's awesome.
Yeah.
I paced our chief of surgery at that a couple of years ago. It was awesome. Amazing. But he was like, "Oh, have you ever heard about the Flyathlon?" And I was like, "No, what's that?" And he's like, "Oh, it's run, fish, beer." And I was like, "That sounds phenomenal." So I registered in the car in the parking lot, and I went to, we have an event in Lake Fork. So I went down there. I was definitely a stronger runner than fishing at that point in time. I kind of dabbled in fishing. My parents were really big into fly fishing. I remember them leaving me with my grandparents while they went on a fishing trip in Alaska. My dad grew up, he was always tying flies. And we were always fishing on the weekends. So it was kind of always there, but I wasn't super focused on it. And then I did my first Flyathlon, and I struggled like no other to catch a fish. At these events, they have what's called a trout whisperer or fish whisperer. And so this guy, Ben McGee, who is a USGS scientist and the fishiest guy I know, I fished with him, and I was just all into fishing. So continued to progress my fishing, went back to the same race year later, and won overall, both for men and women. Caught a really big fish fast. So how the events work is there's a set course, and somewhere along the course, you have to catch a fish. And then you get time taken off your overall running time based on the size and the species of the fish. So you can be a pretty mediocre runner and really good at fishing and do really well.
Wow.
So
how far is the run?
That one was 10 miles. So we have events in, there's Middle Creek, which is outside of Swatch in sort of the San Luis Valley, Central Colorado. Lake Fork is by Gunnison. And then we have a race in Ohio or Iowa, Driftless region, a new race out in North Carolina. And then this year there's what's called NASCAR, where it's actually more of a team event. So similar to NASCAR, you have a pit crew. So one person is the pit and the other person is racing. So they run a mile loop, come back, catch a fish, drink a beer, and then the next person goes, runs a lap, catches a fish, drinks a beer. So more of a shorter but team style event. And then there are also challenges. You can't have races in wilderness. So we have challenges. So there's Troutman and Troutwoman, which involves running at least a marathon, minimum of 3,000 feet of vertical gain, catching all 4 species of Colorado trout, drinking a 12% Colorado beer in under 12 hours. Wow. So I was the first woman to do it. I did it in the Weminuche area, which is one of my favorite places to fish in Colorado.
So let me get this right. It's a marathon on trails.
Mm-hmm. At least a marathon. What's tough is you can't have certain species of trout, like cutthroat and brook trout, can't live in the same area because they outcompete. So you have to have some sort of barrier, which often means you have to get into a different drainage, which definitely adds a lot of distance and vertical gain to be able to get those different species of fish. And it definitely takes a lot of planning and timing, being at the right place at the right time when, temperatures are right. If you're too late, it's too warm, having the right flies. So they're a really fun event and way to challenge. So I've now finished it 4 times, 2 in the Weminuche, once in the Huerfano, and then once in down in the Collegiate Peaks.
Wow.
And this year I'm training for what's called Old Trout. So 50 miles, 5 species, definitely challenging because there's 4 main. So I have to get a sort of one of the oddball salmonoids, and then drink a 15% beer, I think, and then in under 18 hours or 15 hours. So I need to find out. But we're going to do that in July down on the Grand Mesa.
No kidding. So the species, rainbows, cutthroats, brown?
Yep. And rainbow. Rainbows, cutthroats, browns, and brookies.
And brookies. Okay. Lake trout aren't in the game.
No, but that's an option of a 5th species. So a couple we can target: tiger trout, lake trout, grayling, another option as well too.
That's fascinating. I grew up in Wisconsin, and when I was a kid, when triathlon started, like the Ironman, we considered a triathlon to be like shooting pool, darts, and bowling. That was a good
That's
triathlon.
Awesome.
With a beer, so it's a quadrathlon.
That's awesome.
That's fabulous.
Yeah, it's been a really great event to be part of. So after doing many of the races, a few years ago, I joined the board of directors for Running Rivers, which is the nonprofit that puts on the races. It's a great organization. So our goal is to turn recreationists, fishermen, and runners into conservationists. So the events have a big crowdfunding. It's always great. Runners are so competitive, and they'll compete against anything. And so you start driving them towards doing their own crowdfunding, which definitely our biggest competition is the crowdfunding. And so the participants, the fly athletes, will raise funds from friend's family, and which we then put those dollars into conservation projects. We've done a lot of work in Sand Dunes National Park. National Park system gets kind of bogged down with bureaucracy. So they had in the Sand Creek drainage Rio Grande cutthroat restoration project that had kind of stalled due to lack of funds. And because we're such a small, nimble organization, we were able to directly fund helicopter to get fish in. It's really remote. And it's nice to be able to see some of these places that you worked on start to have these thriving native cutthroat populations.
Wow. That's phenomenal. I imagine your daughter's catching fish and right on your tail and getting ready to do some racing.
She is. She did her first Flyathlon. She did a Flyathlon 2 years ago. It's really cute. She did awesome. She raised a bunch of money, ran really far. The fishing was super tough, but she did it. So she's awesome. She's quite the little athlete. She's a very big skier. She just finished the Vail Devo program. I can no longer keep up with her on skis. I think I'm just going to fish from now on and let her go, and she can ski with my husband and they can tear up the slopes while I catch fish.
Well, there you go. Wow, that sounds so fun. Lots to do in Colorado, no doubt.
Yeah, we are very lucky. It's a pretty awesome. Down at Denver Health, you can fish the South Platte. It's urban fishing, but you can fish just a few blocks from the hospital. It's awesome.
Unreal. We have a lot of fishermen at the school. They'll be like signing up, getting in line to do the clerkship there, to go fishing.
Totally. No, I'll take any of them fishing.
Sounds good. So I promised we'd circle around and talk about podiatric medicine. If you were to interface with a young pre-med student who's contemplating a career in podiatry, what would you tell them, Kristine?
What would I tell them? I think our profession can kind of. I think it's an amazing profession. I can't tell you how many times a lot of the trauma surgeons here have been like, you guys, like, I should have done podiatry. Like, you guys, like, you do like a great mix of clinic and surgery and really good lifestyle. Not a ton of trauma call. We take a lot of call, but it's a really good balance. We had one of our scrub techs the other day in the middle of the case. He's like, I know what I want to be when I grow up, a podiatrist. It's like, oh, gosh, I love that. So I'm biased, but I think it's the best profession. I think for our podiatry students and residents, I think being proud of what they do. I think sometimes people are like, oh, well, did you go into podiatry because you couldn't get into med school? I didn't apply to a single med school. I didn't want to go an MD route. And so I think being proud of what you do and where you're at, we changed the lives of a lot of people. There are definitely, Denver Health, we see a lot of really severe infections. There are definitely a lot of people here who would die without podiatry services. We see a lot of interesting, like neurologic injuries from gunshot wounds. I had a patient the other day who had bilateral compartment syndrome with terrible equinovarus. He had no resources, no insurance. So he actually crawled around on his knees. He was young. He was like in late 20s, crawled around on his knees and had these like just huge goober calluses on his knees because he had developed such a severe equinovarus that wasn't even braceable. So we did plantar arthrodesis on both sides, and he's now fully walking and working at Amazon, and came in just to tell me that, and which makes me get teary just thinking about it.
That's awesome.
So it's pretty amazing when we get to do those things.
No, there's no doubt. That is very well said. Same with me. When I decided I wanted to go into pre-med, I went into podiatry. I didn't apply to medical school either. I went right to California. Yeah,
I wouldn't change it for the world. Yep. I definitely am. Think it's an amazing profession. We do so much good work for so many people. We're strong. I mean, just seeing our residents just thrive. Like I told you with general surgery, just wanting to keep them clearly can hold their own with any specialty. I think this is another great thing about having a residency program where our residents are in with all the other specialties is just it builds that connection of they know what we do and that we do awesome work. So it's really nice to see those kind of relationships. Our residents are, great friends with all the other residents. So it's really nice to see. I look forward later in my career seeing those relationships continue to grow.
No doubt. Well, Kristine, I appreciate you taking time out of your busy schedule to join me on Dean's Chat. What a great discussion. I'm super proud of you. I appreciate how you're pushing our profession forward. Pay it forward.
Thanks so much, Jeff. I really appreciate it. I appreciate you helping me to get to this point in my career.
My pleasure, of course. Well, for all of our listeners out there, if you're on Apple Podcasts or Spotify, please give us a 5-star rating. And if you're watching on YouTube, by all means, become a subscriber. Kristine, I'm going to send you one of these Dean's Chat cups because I know you work a lot of hours and you need a lot of caffeine.
Awesome. I can't wait. I saw someone else would, and I was like, how do I get it? I was looking on your website.
I'll send you 2. How's that sound?
That would be awesome.
All right, Kristine. And cheers, everybody, until next week. And Kristine, thanks again. Bye-bye.
Thank you. Thanks for having me.
You're welcome. Bye-bye.